these are the two main ingredients, the THC and the CBD. And the THC is more responsible for kind of psychoactive parts of marijuana. And the CBD doesn't really have psychoactive components, but it has more effect on, in terms of the pain and spasticity that many patients with MS have to endure. But again, they're not fully understood very well, but these are sort of the main compounds. So the American Academy of Neurology has put out a systemic, or a kind of a systematic review where MS kind of came out as probably having the strongest evidence for medical marijuana. And the two areas that were most involved were spasticity and pain. That is indeed sort of what New York State has also set up as the indications for medical marijuana. So this is sort of more the overall evidence in terms of medical marijuana and cannabis for neurologic disorders. So nabiximols, I mentioned that a minute ago, that's Sativex. That's the drug in Europe that's been approved for spasticity and pain. And you can see they did studies on this. So they looked at clinical trials where they compared patients on Sativex and compared patients on control, so on some kind of placebo. And they found that this pain scores from this version of the Sativex versus placebo were significantly reduced. They also had a decrease in the self-reported spasticity scores as well, which is the upper one here. So, and it seemed to be sustained over time. So this data was used and it was then approved in Great Britain and several other countries for use in MS patients. You can see it's given by an oral route where you have a spray. So, MS pain, I'm assuming you guys don't have to tell you about MS pain if you're here. It's a very diverse thing, and I think it's not one thing. I think there's different types of pain. And central pain is kind of pain from MS lesions where you get, it's often a neuropathic kind of pain. Patients report burning deep inside the body. It's often constant, doesn't really resolve very easily. And it's not as much like spasticity pain is more cramping. It can be most often the legs versus the arms, but it will last for a few minutes and involved with muscle spasms. Then you have all kinds of musculoskeletal pains because MS may affect the way you walk or the way your balance. So you may have different orthopedic issues even with MS or back pain. And then you also have pain from headaches and other various pain centers. So these are really the pains that the medical marijuana targets. The central pain and the pain from spasticity. And in the old days there was this is from the 1903 or actually 1888 maybe. But this kind of very well-known neurologist at the time wrote about MS and said it's remarkable how free from discomfort the patients are. So obviously maybe wasn't listening to the patients very well because these days there's a lot more acknowledgement that pain is common in MS. And the number of studies about pain in MS, this slide shows you from 84 up to 2010. So there were only a few studies in the 80s, but as you go up to 2010, this number of studies involved with pain in MS has gone up exponentially. So people are taking much more attention to some of the symptoms of MS and trying to help patients manage them. And this is a little bit about some of the cannabinoid receptors. So, you can see that this is an example of some of these are the neurons in the nervous system, picture of that, and these are areas of demyelination. So that's where the immune system would demyelinate or attack the nerve fibers. And this is an example of some of the cannabinoids act on some of these receptors, where they interface between neurons and help to downregulate the pain response in patients. So where you would ordinarily have an excitatory output, it can decrease the amount of excitatory output in these cells. And there's actually literature on how cannabinoids do this. So I think it is a promising treatment for symptom management. But because of the interest in it, there's also been a group of people and advocates that have written about cannabis being kind of a cure-all as well, like a sense of, you can see here anti-inflammatory, neuroprotective, nutritional, antioxidants. So this is an area of a little bit of controversy. We don't know, there's no evidence in my mind from a traditional medicine point of view that cannabis can affect the slope of MS, the curve of MS. I don't really think it has an effect on stopping the inflammation of MS per se. I think it can help downregulate the pain and help with spasticity, and may also help some other patients with some other symptoms as well. But I don't think it's effective as a treatment for MS. So I think, but you know, there's really no evidence. The only studies that have been done have been on THC Marinol, which showed no change in progression of MS. When they compared patients on THC, patients on nothing, they progressed at the same rate. So I think at the end of the day, marijuana isn't a miracle cure. It's not something that's going to fix your MS. It may help you manage your symptoms, and many patients that have enrolled in the program now, probably anywhere from 50 to 75 patients at our center, and the response has been pretty good. You know, most patients have felt like their symptoms were improved with the addition of medical marijuana. I've had some patients that have been able to say, you know, I've gotten off my opiate medicines, or I've been able to go down on my baclofen or my gabapentin, because a lot of these other medicines have so many side effects too that I think people feel very over-medicated often when they're on gabapentin, baclofen, trileptal, you know, and it's very challenging to kind of like feel cognitively even alert and awake when you're on so many medicines. There are some potential side effects of medical marijuana, and any drug that works, I think, has the potential for causing side effects. So one of the things that people have been concerned about and studied is the effect on cognition, because as I'm sure all of you are more than aware of the amount of patients with MS who report cognitive problems, and anywhere from word finding problems to processing speed to memory issues. You know, many patients with MS just really struggle with some of the cognitive domains, so that's the one area where I feel a little bit of concern about medical marijuana, because I think it's important for patients that we don't make things worse when we're offering treatments for them. But I think at the end of the day, it's a very individual decision. Many of the studies have been on medical marijuana don't show a clear effect on cognition. Some of them do suggest that there may be slow processing speed or worsening memory. I think it might be a degree of use. If you're using it very heavily for long periods of time, it could potentially have that kind of side effect. There's also some people that have written literature about the risk for psychosis, so this would be delusional, hallucinations, paranoia. So I think it's important that patients who would be enrolled in this program would be screened, and that's what New York State really says. You shouldn't be enrolling patients that have a history of psychosis or even a strong family history of psychosis in this program, because it seems like there is a risk. The risk for dependence, you know, there is a sort of a idea of a marijuana dependence kind of condition where people become you know, kind of almost like addicted to it, I guess. But I think when we're using it for symptom management, I don't worry about it as much, because I think people they're not using it to get a high, they're not using it. And actually, we're often using the types of cannabis that minimize the psychoactive parts of the drug. And we're using it for pain or spasticity, which is a much different kind of situation. So pregnancy risks are pretty much, it's not advised in pregnancy. It's a little bit of an area of controversy. There are some risks with people who may have unstable heart disease or angina, but that's not the typical patient that we deal with. So, you know, there's some studies that show a little bit of evidence of decreased volume in cannabis, but again, these studies are very short-lived, they're not very long. And I think there's risks, so it's not necessarily that there's no risk, but I think that's part of any treatment we would offer for MS. So what makes it a little different from a typical drug you might take for you know, pain or spasticity is because it's not necessarily one thing. And I kind of mentioned before, medical cannabis is literally hundreds of compounds. And of course it's found in nature, so some people come in and they like the fact that it's sort of a natural compound. It's something that is more, not so much of a pharmaceutical product. This is a drug, M367, that's a synthetic form of fentanyl that killed, I think, you know, dozens of people in California from overdose. So you can see the dangers of some of our pharmaceuticals are not trivial. So, you know, especially opiate medications for pain, I'd be much more concerned about patients heavily taking opiates than about medical cannabis, because the risks for overdose in medical cannabis are almost non-existent. That gets me to dosing a little bit too. With medical cannabis, the recommendations by New York State, they really can't outline dosing for patients, how much will work for you. It's trial and error, and that's true of a lot of our drugs, but in terms of medical cannabis, it's kind of like you start with a low dose and you kind of increase slowly and you try to minimize side effects. So this is the process for New York State's medical marijuana enrollment. You have to contact a physician who's licensed to enroll patients. So I did the training, and there's another one of our physicians at our NYCBusinessNews.com Center that did the training as well. So we had an interest in offering this for patients who were appropriate and who were interested. So once you do that, you meet with the physician, you go through the risks and benefits, and if it's felt to be a helpful treatment, then you basically get a certification from that physician. And then you go home and you go online and you do your own kind of registration online. And then at that point, New York State will mail you a card. You got a picture up there that looks like a medical marijuana card. So it's like a driver's license basically for medical marijuana. And it's a bit of a process, so it's not easy. But if you're interested and you kind of stay, it's not so bad that you have to spend $50 too. So the different forms of medical marijuana, there's sublingual tinctures, so that's what this is trying to show here. It's basically a dropper, and you put it under your tongue and it absorbs into directly into the bloodstream. And the different forms in New York State there's 20. So the 20T means 20 parts THC to 1 part CBD. So the THC, remember, is the more psychoactive part. It can help a little bit more with sleep or anxiety, anecdotally, and it's better for the nausea and vomiting as well. And then there's a 1-to-1 ratio, and then there's a low THC, high CBD. So a lot of our patients are most interested in the low THC, high CBD, because that's going to have less of the psychoactive effects, and it'll have more of the pain and spasticity relief effects. But at the end of the day, it's kind of trying to find the one that's right for you. So that's the different forms offered. And they also offer a vaporizer and a pill. So that's sort of the landscape of medical marijuana. And so is cannabis right for you? I think it's a very individual decision. Patients who meet the criteria set up by New York State, I'm always happy to speak with them and talk about. We're gaining some more experience from our patients now who have enrolled, and I think the target symptoms remain spasticity and neuropathic pain. And there are some patients that probably shouldn't try, but I think in our general MS population, we haven't encountered too many patients that seem like they would be excluded from the program. And I think there are potential upsides for sure, but it's not without risk. I think anything that you take in MS, and I'm sure if any of you are on these disease-modifying drugs, you take a risk every day, right? Because you've probably outlined all of the risks of the various drugs, but then not treating your MS too is a risk. So I think MS patients are very used to the idea of trying to quantify and measure risks. And I think the cannabis, it seems quite safe overall compared to some of the other drugs. So that was what I had for medical marijuana. And I also had a little bit of a talk on depression too. I don't know if you guys want to stop here and talk with questions about medical marijuana, or if you want to end here, or do you want to hear more about depression and MS as well?
I actually have one question.
Sure.
On the medical marijuana, is it, it's processed, pharmaceutically processed, so is it still?
It is.
So it's not 100% natural anymore, correct, or no?
Well, they don't add anything to it. I mean, New York State